Okay. We are going to go ahead and get started. We've got lots and lots to cover. I'm going to ask that everyone just goes ahead and makes sure that they are muted. I will also cover that. Okay. So welcome to our third and last session of our menopause series. For those who are joining us for the first time, we have part 1 and 2 up on our YouTube channel as well as on our website. The first week we talked about what menopause was, how it affects our body and our brain, and how it is all connected. Last week we discussed the hormonal and non-hormonal therapies that are out there. And today we're going to talk about lifestyle and integrative health. So we'll talk about foods and the foods that we can eat that can help us with our menopause symptoms. Because of the amount of questions that we have gotten, I have also added a Q&A session. So that will be April 14th. I have it listed from 12. It'll just be for however long it takes us to get through the questions that you guys have asked in the survey I've sent out. I will also have that QR code for the survey at the end of this workshop. So if you have even more questions afterwards, you can go in and submit your questions and I'll make sure that we get those answered on April 14th. But today we are going to jump right in. So the first thing that we're going to talk about is exercise. I know, sorry, I just saw in the chat. Yes, it will be recorded as well, the Q&A. Thank you for asking. Okay, so exercise. I know that we all know the importance of exercise, but it is especially important when we are in the throes of menopause. The CDC reports that less than 40% of Americans exercise the recommended 2.5 hours a week. And the worst offenders are those not exercising are women who are 40 years and older. So I know that especially as we're having those symptoms of menopause, we're tired and we have headaches, and your body literally feels like it is fighting against you. And that is so true. And I'm not trying to take away from that, especially as we're experiencing menopause and when our estrogen levels drop, many women experience an increase in fatigue, achy joints, and decreased stamina. But this just adds to the point how important it is that we get up and we move our body. On average, women in midlife, so between about 45 to 60, they gain 4 to 5 pounds and add about 1 inch to their waistline. We talked about this a little bit the first 2 sessions, but this is most likely due to the increase of belly fat that increases during menopause. When our bodies start to transition from estradiol to estrone, our belly fat increases due to the fact that estrone is found in adipose tissue or belly fat. And so this increase is often temporary. However, it only stays temporary if we continue to treat our body with the respect and dignity it deserves by moving it every day. And so while I know that most of us know the benefits of exercise, I want to touch on this briefly. She spends a really big chunk of the book talking about how important exercise is, especially when it comes to heart disease. So heart disease still remains the #1 killer of women over the age of 50. And the loss of estrogen is a big factor in this. The good news is that in just 12 weeks that we can improve the strain on your heart and decrease your waist circumference and lower your triglycerides and cholesterol simply by exercising daily. Exercising daily has also shown to directly change the number and severity of hot flashes. It improves mood stability and enhances our sleep. In fact, in clinical trials, women experiencing menopause symptoms who take up a daily exercise routine saw a significant reduction, so much so that many people even reported a complete elimination of hot flashes. This has to do with the fact that when we're exercising, our body is learning how to control its body temperature. And so that can help us decrease those hot flashes. Exercise is also incredibly important during menopause because during that middle age stage, right? So 45 to 60, we also see a huge increase in metabolic disorders, things like insulin resistance and type 2 diabetes. This is once again due to the loss of regulation we have because we lose estradiol. And exercise is one of the biggest combatants to metabolic disorders, as well as things like heart disease, strokes, high blood pressure, osteoporosis, colon cancer, breast cancer, anxiety, depression, and dementia. Many of these symptoms can see a reduction in just 12 weeks of daily exercise. In fact, recent studies have shown that those who engage in regular exercise see a 35% decrease in risk for dementia. This also helps with our brain fog, which is one of the biggest complaints that we get when we're talking about menopause symptoms. So there's so many benefits to exercise. There's also so many ways to move our bodies. And so that's an important thing to remember. And she spends some time on this topic talking about how often we should exercise and the intensity. So remember that the CDC recommends 2.5 hours of exercise a week. Lucky for us, Dr. Mosconi broke it down even more so that we can see the recommendations for before menopause, during menopause, and after age 70. So before menopause, our goal should be 4 to 5 days of 45 to 60 minutes of exercise. I have 45 to 60-minute sessions, but this can be broken up throughout the day, right? So it can be 15 minutes in the morning, 15 minutes at lunch, 15 minutes before dinner, and 15 minutes before bed. That totally works and totally counts, and is still getting in that movement and has the same positive effects. During menopause and through age 65, we know that our bodies are tired. It's going through huge shifts. And so that 45 to 60 minutes might not seem as feasible. And so the recommendation is a minimum of 3 days to at least 5 days of 30 to 60 minutes, right? So if you do 5 days, then you can do 30 minutes a day. And then after age 70, 7 days a week for 15 minutes is the recommendation. But of course, right, if you can do more, then do more. It will help your body. It will help your symptoms. It will keep you stronger and healthier longer. As for the intensity, recent studies have shown that moderate intensity is the best intensity for women of all ages. So moderate intensity is when you're breaking a sweat and you can talk, but you definitely could not sing. Moderate intensity is linked to the lowest risk for heart disease, stroke, diabetes, and cancer. And more studies are showing us that high intensity training actually have diminishing returns for women. And this is most likely due from the fact that when you're exercising at a high intensity level, your cortisol levels naturally spike. And women tend to not need more cortisol in their body. We tend to have more than enough. And so that stress level keeps our cortisols higher. It can cause a state of chronic stress, which then increases our inflammation and has a cascade of other issues. High intensity workouts also require more sleep and rest to recover properly, which is usually an elusive commodity for most women. So if you love high intensity or HIIT training workouts, that's totally okay. There's definitely a time and place for them, but we also just want to make sure that we are treating our body with care and taking into account our cortisol levels and our ability to recover. So if HIIT training is your go-to, maybe consider moving it to 3 days a week instead of 5 days a week. and having a moderate routine for a few days. Okay, any questions on exercise? Cool. Okay, let's move on to nutrition. This is the one that I got a lot of questions on last week, and we're going to spend a lot of time on this. But as we pivot to nutrition, I do want to say that, as most of you know, I am one of the 2 certified intuitive eating counselors on our employee wellness team. So I would be remiss to remind you of the importance of listening to your body and eating the foods that bring you the most joy, pleasure, and nourishment in your life. Those who follow an intuitive eating lifestyle have often found themselves gravitating towards a plant-based diet anyways. So if you find these next few slides triggering, please feel free to reach out and we can chat. But I do want to share what Dr. Mosconi recommends when it comes to treating our menopause symptoms through diet. And her biggest recommendation is the green Mediterranean diet. So the green Mediterranean diet has long been hailed as one of the healthiest and best diets for chronic disease prevention. It takes the natural diet of those in the Mediterranean and mixes in a few additions from across the world that's known as blue zones. So blue zones are areas in the world known for having the longest living individuals with the least amount of chronic diseases and the most happy dispositions. This diet is a plant-based diet, which means that the majority of your meals come from plants, with just a small sprinkling of animal proteins. And so this plant-based diet means that the majority of your plate, when you're looking at your plate, 50 to 75% of your plate is going to be vegetables. And the more, the merrier. So we want a lot of variety so you get a good variety of nutrients and benefits. The fruits and vegetables that are eaten are best eaten in season during the Mediterranean diet, which is great because our budget often works better with those that are in season because those fruits and vegetables are going to be the cheapest. Protein makes up the other 25% of your plate and are mainly derived from plant sources such as soy, lentil, beans, and whole grains. Nut and seeds also play a predominant role in this diet, as well as other healthy fats such as extra virgin olive oil, flaxseed oil, and avocados. When you're cooking your meals, most of your flavors come from citrus fruits, vinegars, and fresh herbs. Beverages are 90% water with green tea, high quality local wine, and espresso also sprinkled in there sparingly. Red meats and dairy are also eaten very sparingly, often going weeks or months in between their inclusion. This is especially important when looking at those complicated Mediterranean recipes. When I was just doing some research for this, and if you type in Mediterranean recipes, a lot of times they have like lamb or expensive cheeses come up in those recipes. And that is not in line with the green Mediterranean diet. Lamb is considered a red meat. Cheeses are obviously a dairy. And so those are things that would be for very important occasions and would not be a daily Mediterranean occurrence. This diet also rejects processed and refined foods. So it focuses instead on natural sweeteners such as maple syrup, honey, and dates, especially when creating their desserts, which are enjoyed at most once a week. Dr. Mosconi spends a great deal of time discussing all of this in her book, Brain Food, and really diving into the exact amounts and nutrients we should be aiming for. So if you're looking for even more on like exactly what nutrients we should be looking for, I highly recommend diving into that book. Or I actually did a book workshop on brain food last year. And I can send that out in an email for any of those who are interested in looking at that recording. Okay, the other thing I want to talk about when it comes to nutrition is estroblome. So estroblome is why a plant-based diet is so important. It is a group of gut bacteria that has the unique ability to metabolize estrogen. So once estrogen has made its way through the body, it ends up in our intestines, and this is where the estroblome kicks in and decides if that estrogen needs to either be kicked back into the bloodstream or head to waste removal. This process is key in making sure the amount of estrogen in our body is right. However, dysbiosis is a problem that occurs when the number of harmful bacteria outnumbers the good. When this occurs, our estradiol cannot do its job. So how we make sure that our microbiome is balanced is a plant-based diet. In fact, when we reject a plant-based diet and we get the majority of our food from processed food, it can reduce the biodiversity in our gut by 40% in just 2 weeks. And so it's really important that we make sure our gut bacteria is healthy so that our estrogen levels can be healthy and thriving, especially when we're going through menopause and we're already seeing dips in our estrogen levels. The way that we can do this is by consuming prebiotics, probiotics, and bitters. So prebiotics are non-digestible carbohydrates that feed the good bacteria in our gut. They are found in foods like garlic, onion, asparagus, beets, cabbage, leeks, artichokes, beans, peas, and legumes. Probiotics are live bacteria that repopulate the microbiome, and they're found in fermented foods like sauerkraut, kimchi, unsweetened yogurt, brine fermented pickles, among other things. Supplements are often a good choice if fermented food is just not your cup of tea. But when you're looking at supplements, you want to find one that has all 3 strains of live bacteria. So you want to find one that has lactobacillus, rhamnosus, and bifidobacterium. So those are the 3 that are really important when it comes to our probiotics. And then the last thing that we can do to stimulate our gut health are called bitters. So bitters are literally just digestive stimulants that can help our microbiome, and they're found in foods that are just like their names. So that are bitter. Common ones are dandelion greens, endives, and arugula. Obviously, this is not an exhaustive list of foods, but these are the most common ones that you can find for a pretty good price. So when we're dealing with our raging hormones and trying to make sure our estrogen levels are as balanced as they can be, ensuring that our gut microbiome is healthy should be our first line of defense. Another thing that we can do is ensure that we're getting some phytoestrogens. So phytoestrogens are another topic that has been circulating around social media. So what are they? They are estrogens found in plants with a similar makeup and functions as the estrogen our ovaries make. There are 3 different types of plants that contain these estrogens. There's isoflavones, I don't know, forgive me for my pronunciation, which are found in soybeans, tofu, tempeh, lima beans, chickpeas, and lentils. There are your lignans, which are found in flaxseed and sesame, dried apricots, dates, peaches, berries, garlic, winter squash, green beans, wheat, rye, pistachios, and almonds. And then there's your comestants, which are found in sprouting seeds like alfalfa. So once again, not an exhaustive list. There has been over 300 plants identified with phytoestrogens, but this can kind of give you a good idea of where to start. Now, phytoestrogens are about 1,000 times weaker than our estradiol. So in order to get the benefit of them, you have to eat plenty of them, and you need to eat them consistently. But there are amazing benefits with these phytoestrogens. Basically, what they do is they act as a SERM, if you remember from our last workshop. So this means that when our estrogen levels are high and we're eating enough of these phytoestrogens, the phytoestrogens will then block our estrogen receptors to help level out our levels. When our estrogen levels are low, they will go to our receptors and help bolster our estrogen levels. And so they have this really incredible effect of helping us manage the estrogen levels in our body. A recent study showed that a plant-based diet rich in soy reduced moderate to severe hot flashes by 84%. That is better than HRT. In fact, within half of the postmenopausal women experiencing hot flashes who ate a plant-based, soy-rich diet, meaning half a cup of cooked soybeans a day, became free of hot flashes. So if you're postmenopausal, this can be a really, really good option to help with those hot flashes that is not medication. And all you have to do is eat some soybeans. Foods we should avoid when it comes to our menopause symptoms. If we want to eat the majority of our foods from plants, then the majority of our food cannot come from processed food. Study after study has led us to the statement that the majority of people in the United States consume 50% of their food in a processed state. This includes popular processed meats, such as deli meats, boiled hams, bologna, hot dogs, and meat sticks. In fact, recent studies have shown that processed foods may be the culprit for as many as 45% of the deaths related to heart disease, strokes, and diabetes. On a menopause note, spicy foods may increase the duration and number of hot flashes, so it's best avoided during the perimenopause and menopause symptoms of life. But once again, you know yourself best. So if you love spicy food and you could live with the side effects, that's great. Go for it. Another recommendation she gives is to limit alcohol, as it's seen to not only worsen hot flashes, but affect sleep and increase breast cancer risks. So moderation is key when it comes to alcohol. And then the last thing she recommends is limiting caffeine. Caffeine not only worsens hot flashes, but it also affects our sleep, especially because it takes 12 hours to leave our system. So if you must enjoy caffeine, her recommendation is let it be 1 cup and enjoy it before noon. So now we're going to move on to supplements and botanicals. These are herbal remedies and supplements that are available. But before we begin, I want to remind you that these cannot substitute for a poor diet and lifestyle. These should not be used to try and take a shortcut, but instead should complement a well-rounded diet and active lifestyle. But these can definitely help with some of our symptoms. So we're going to go through a lot of these. The first one is black cohosh. Its usage is for hot flashes. It's also approved in Germany for hot flashes, heart palpitations, nervousness, irritability, disturbed sleep, vertigo, and depression. The scientific proof of efficacy is medium. So the clinical trials show about a 50% reduction in hot flashes when taking black cohosh. The dosage is 40 milligrams per day. Because of the lack of scientific studies out there, the recommendation is to use only for a maximum of 6 months. Some of the side effects can be headaches and in rare cases, liver damage. The next one is chaste berry tree. This is used for just general menopause complaints, as well as fertility and hormone balancing. Scientific proof of efficacy is low. So when I'm talking about scientific proof of efficacy, this is just saying, they're taking all the clinical trials that have been done and seeing what has been found. Some of these botanicals aren't going to have had hardly any scientific studies, which will make all of their efficacy proof low. So do with that what you will. The dosage is 200 grams per day, and it can interact with some birth control pills, Parkinson's medication, and psychosis medication. The next ones are your Dong Quai. This is used for hot flashes, and it is used in traditional Chinese medicine for the treatment of menstrual pain and irregularity. The scientific proof is low. However, the preparations used in the trial for this was not the same used in traditional Chinese practice. So we don't really know how effective it was. The dosage is up to 150 milligrams per day and may interact with blood thinning medications. Evening primrose is used for hot flashes and breast tenderness, especially when combined with vitamin E. Efficacy is low, dosage is 2 to 6 grams per day, and may increase the effects of HIV medication. The next one is ginseng and maca. So they're basically the same plant. It's just where they're found. So ginseng is found in Asia, maca is found in Peru, and they are adaptogenic herbs that promote resistance to external and internal stressors. They heighten concentration, improve sexual function, promote arousal, support menopausal depression, and low mood. And there is moderate proof of efficacy here. The recommendation is 400 milligrams per day with a maximum use of 6 months. The precaution is insomnia, so the recommendation is to take it in the morning. And then it has a whole slew of different side effects that could happen. All of those were low in possibility, but they're listed on the screen for you. The next one is kava, which is used for hot flashes and anxiety. The scientific proof of efficacy is low. Dosage is 50 to 250 milligrams per, and the FDA has recently issued a warning because of the potential damage to the liver with kava. So just be aware of that one. Okay, so let's talk about some phytoestrogens. Once again, right, phytoestrogens come from plants, and these are ones that we can specifically take that can help with our menopause symptoms. So you have your soy isoflavones, which can be found in your soy protein isolate, soy-rich extracts, as well as just capsules. They're used for hot flashes, as well as recent studies have shown that they may have a very positive effect on bone density. Scientific proof is medium. They saw a 50% reduction after 16 weeks, and the dosage is up to 150 milligrams per day. This one is not recommended for those who have had or are at risk for cancer. Clean soy has seen no risks for cancer, but a lot of the soy that we get, especially in the United States, the healthy parts have been taken out. So when you're looking for soy protein or soy-rich extracts, we want to make sure that they're a clean soy product. And then another one is red clover. Red clover is used for night sweats, and it saw a reduction in night sweats by 73%. So scientific proof is medium. 80 milligrams per day is the dosage, and it is safe for use up to 3 years. So this could be a great option if you're looking for an alternative to HRT. Flaxseed is used for hot flashes. Proof of efficacy is low. 25 grams of ground seed daily is the dosage. That's about 2 spoonfuls. Precautions are just your GI issues, bloating, nausea, diarrhea. Then you have rhodiola, which is used for stress, fatigue, and metabolic activity. Efficacy low, 100 milligrams per day. Dizziness, dry mouth, or excessive saliva production is the side effects. And then the last 3 phytoestrogens we'll talk about is St. John's wort, which is used for anxiety, mood, and depressive symptoms during perimenopause. This has a really high scientific proof of efficacy. 900 milligrams per day for up to 12 weeks. However, it can interact with a variety of medications. So if this is a route that you go to help with some of those perimenopause mood symptoms, definitely talk to your doctor and make sure it's not going to interact with any medications you may be on. Tribulus is used for low libido. It does have a low proof of efficacy, but participants who use this report high effects. So there is that. The dosage is 250 to 1500 milligrams per day. Headaches, dizziness, upset stomach, or fatigues are your side effects. And then valerian root is used for sleep support. It has medium efficacy, and you take it an hour before bed. Fatigue in the morning is one of the ones that most people complain for this one. So just make sure you're prepared for that. Okay, so physical pills and supplements that we can take. Vitamins B12, B6, B9, and B5 are essential to our brain, to our whole body functioning. And so if you are on a strict plant-based diet, which the Mediterranean green diet is very plant-based, you will most likely need a vitamin B12 supplement because B12 is found in animal products. Also, most chronic disease medications affect B vitamin levels. So if you have a chronic disease and you're on medication daily for that, chances are your B vitamin levels are low. So it may be good to get your labs checked out so you can see exactly where your levels are at and what vitamins you may need more of. The usage is for stress and cognitive support. The scientific proof of efficacy is medium high. And then the dosages are broken down on the screen. So you want 500 mcgs of B12, 600 to 800 mcgs of folic acid, which is your B9, 10 to 50 milligrams of B6 taken daily with food, optimally in the morning. And then for stress support, you can add in 100 milligrams of B5. Generally, they're very well tolerated. These are vitamins that our body needs and that a lot of people don't have enough of. Calcium and vitamin D paired together are there for bone health, high proof of efficacy. You want 1,200 milligrams of calcium from all sources. So you need to take into account the foods that you're eating to know exactly what your supplement should be. And then vitamin D. Most people in Utah tend to suffer from a vitamin D deficiency. So this is a great one to talk to your doctor about and making sure that your vitamin D levels are where they need to be. And then calcium can decrease the efficacy of some certain antibiotics as well as medications. Other supplements are magnesium and melatonin. Both are for sleep support. Magnesium actually has a very low proof of efficacy despite its popularity. It's up to 3 grams of magnesium citrate 1 hour before bed. And the precautions are it also has an effect on our gut. And so it can cause loose stool as well as decrease the efficacy of certain medications. Melatonin has a high efficacy. The dosage is 1 to 3 milligrams at bedtime. Max dose is 6 milligrams for no more than 2 weeks because it can dysregulate our own melatonin production. So it's not something you want to take every day. And then it has a possible interaction with sedatives. Okay, I believe these are the last 2 supplements that we're going to talk about, which are your omega-3s and your vitamin E. So omega-3s are anti-inflammatory that support the heart and brain, night sweats, and cognitive support. The proof of efficacy is low for night sweats, but medium high for mood and cognition. When you're looking for omega-3s, we want to make sure that it is a high purity omega-3, specifically from fish oil or algae oil, and that they specifically contain milligrams of EPA. Precautions are headache, dizziness, stomach upset, or fatigue in the morning. And then vitamin E can see a 35 to 50% reduction in hot flashes. This is especially useful for those who currently have breast cancer. It has medium to high efficacy. The doses is 800 units. And the interactions are just a moderate interaction with blood thickening medication. If you do have heart disease or diabetes, the recommendation is to not take more than 400 units per day. Okay, that was a lot of your supplements and botanicals. We have a couple more things to get through, and then I'll open it up to questions. The other thing that she talks about when we're talking about menopause symptoms is managing our stress levels. Stress is a normal response to danger in our environment, and acute stress is a short-lived response to imminent danger, and our body is set up to respond to it with a flood of cortisol that keeps us on high alert in our flight or fight mode. But the issue comes that when stress levels become a chronic state of living, because this constant flood of cortisol in our system disrupts a very important system, and that is our sex hormone system. So pregnenolone is a molecule that makes our sex hormones and our stress hormones. So when we live in a constant state of stress, our body has to prioritize one of them. And as you can guess, it is not our sex hormones that get prioritized. Instead, it is cortisol. And so the result is we have a decreased efficacy of sex hormones like testosterone and estrogen. And this choice leaves us in a state of inflammation that can promote hot flashes, anxiety, and depression. When we live in a chronic state of stress, our mood also quickly deteriorates, and we have a significantly higher risk for dementia. So it's so important that when we're talking about menopause, that we are also working to manage our stress levels so our body has the optimal opportunity to regulate our hormones. Dr. Mosconi gives us 9 different tactics that can help with our stress levels. The first is yoga. The history of yoga is a long one and one that has proven effective in managing stress by giving our bodies a physical release while turning our mind to the present and requiring deep breathing techniques to allow the stress to work out of the body. If you have not ever had the chance to practice yoga, I recommend giving it a try. It can definitely help. Second is meditation and mindfulness. It's also an effective tool in learning how to recenter and come back to the present moment. We have our monthly mindful moments that I invite all of you to join in every month for that. Hypnosis can also be effective in planting positive seeds for change and easing discomfort. You can seek out specific hypnosis professionals that work with menopause patients. There's cognitive behavior therapy, which is an action-oriented psychological intervention that helps people develop practical ways to manage their problems and provide coping skills and strategies. 5 is paced breathing and relaxation training. In clinical trials, breathing and massages have both reduced the frequency and severity of hot flashes significantly. Acupuncture is a traditional Chinese treatment for a variety of symptoms, and when done by a trained practitioner, can be useful in alleviating menopause symptoms. Aromatherapy can be great for stress and anxiety relief. And then don't underestimate the importance of talking it out. Chatting with friends and family and about your experiences and what you're going through is especially important. We don't live in a society that often talks about menopause, and so gathering together and talking with other women about the things that you're going through is an effective and important way to be seen, heard, and validated in your experiences and can help alleviate that stress. And then don't be afraid to assemble a team. Sometimes we need more than one person on our team. We may need a loved one and a mental health professional and a menopause coach or counselor and a physiotherapist and a physical trainer or a dietitian. And any and all of these can help you significantly as you traverse your menopause journey. So we definitely recommend finding ways to reduce your stress. The other super important thing when it comes to menopause and managing our menopause symptoms is sleep. And I know what you're thinking, Kirsten, you don't understand. I don't get any sleep. Sleep is elusive. And we have talked about many, many medications and foods and take to help with those hot flashes, night sweats, and insomnia that often accompany menopause. So hopefully that has given you some hope with getting more sleep. And our goal is to work towards a full 8 to 10 hours of sleep a night. There are also other things that we can do that can help set ourselves up for success when it comes to sleep. The first one is making sure that we're dimming the lights at least 1 hour before bed. So turning off all your lights around your house, only leaving 1 or 2 on, and then dropping the temperature. The sweet spot seems to be around 67 degrees. So we want to keep it nice and cool in our room, as well as adding in some ambient sound like white noise. Number 3 is put your phone, your tablet, your computer, your TV, everything away at least 1 hour before bed. And when we do go to bed, we want to try to go to sleep and wake up at the same time every day, including the weekends. Our body does better when it is on a cycle that it can trust. Before going to bed, writing down everything that is on your mind can help clear your mind so that you're not laying in bed awake, stressing. It helps drop your cortisol levels and can help you get to sleep faster. Another recommendation is spending a few minutes meditating before bed, recentering yourself, bringing yourself to the present and not worrying about tomorrow. And then trying to avoid sleep meds if possible. Sleep meds can dysregulate our natural circadian rhythm, and it can also prevent us from getting a restful sleep, even though we will be asleep. So that's just another thing to think about. We will also cover sleep extensively in September. We're going to have a whole program that entire month talking about sleep and how to get better sleep. So keep your eyes and ears open for that one. Okay, the last thing we're going to talk about before we wrap up is estrogen disruptors. So she spends a very short chapter talking about your endocrine system and the dysfunction that occurs because of the toxin and pollutants in our environment. And she gave some simple advice and some swaps that we can make out for these estrogen disruptors. Do what you can. Don't feel guilty for what you can't. This one is hard because we don't have a lot of control over what toxin and pollutants are in our environment. So the first thing that we can do is filter the indoor air. You can do this through buying air filters, as well as bringing in plants that are natural air filters. So the examples she gives are snake plants, spider plants, peace lilies, and golden pothos are all natural air filters. When looking at household cleaners, try to buy eco-friendly products, or it's amazing what some vinegar and baking soda can do for you. When you're buying clothes or sheets or pillows or things like that, look for untreated cottons and fibers. Oftentimes, flame retardants and different chemicals that get put into our clothing can be endocrine disruptors. When we're buying our foods, if you have the means, try and buy local and organic when possible, and then make sure, no matter what, that you are washing your fruits and vegetables, and that you're cooking your meats to temperature. Swap out all of your plastic when you can for glass or stainless steel. This can be glass bottles, glass storage containers, stainless steel water bottles, cast iron or stainless steel pots and pans. And once again, you just do what you can, right? If you're in the market for some new pots and pans, maybe consider a more eco-friendly option. And then the last recommendation she makes is getting to know the ingredients in your self-care products and trying to make the swap for cleaner ingredients, and just being aware of what we're putting on our skin and inside our bodies. Okay. To end, I want to end with this word, konenki. In many cultures around the world, menopause is not viewed in the negative light many Western countries and cultures make it out to be. Instead, it is viewed as a shift in perspective and as an awakening and a chance for exciting new capacities. The Japanese word for menopause is konenki, which, when broken down, ko means renewal and regeneration, nen means year or years, and ki means season or energy. I challenge each of you to shift your perspective of what menopause is and what it can mean for you. In the words of one of my favorite books, in every ending, there is a new beginning. So think of the ending of your menstrual cycle as a new beginning. And remember about the positives that we talked about in our first workshop. While it's true that most women grow unhappy in the 3 years leading up to menopause, and that satisfaction remains low for 2 to 3 years after the final menstrual period, over 60% of women report feeling happier with increased patience and less tension and feeling less withdrawn than before they ever started the menopause journey. So there is hope, and there's a good reason to look at menopause as a menopause start. The time after menopause may find you having a renewed drive to ponder those new beginnings, whether that's starting a new career, a new relationship, or new places to see and travel, or a renewal of health and self-care practices. Many women report an invigorating new approach to life rather than feeling stuck and on the end of life trajectory. With the end of our ovary estrogen production, the shift in the brain and the new upload you receive during menopause can result in newfound abilities to draw boundaries and to feel more joyful emotions. In fact, many women report that sadness and anger have less hold of them after menopause. While they still feel these emotions, they're able to move on faster and hold a higher capacity to feel joy, wonder, and gratitude. This shift in emotion also shifts to postmenopausal women experiencing greater empathy, and specifically an improved form of empathy called cognitive empathy, where women are able to understand feelings on an intellectual level rather than just feeling what someone else is feeling. So I hope that even though the past few weeks we have talked a lot about the symptoms and negative changes and what we can do to treat those, I also hope that you have found a reason to look forward to the years to come and not fear this transition in life. What questions do you have? If there's no questions, that's great. Let's see. Laura says this presentation presented magnesium citrate. However, it's been recommended that glycinate is much better for sleep, relaxation, and muscle repair. Citrate is typically better to clean out the digestive system and can act as a laxative. Can you speak on the differences between magnesium glycinate and magnesium citrate? It's just the way that they are concentrated and presented. So the research that I was quoting did specifically look at magnesium citrate. I would have to go more into depth on magnesium glycinate and how that affects the menopause symptoms for sleep and relaxation. So I can definitely look at that for our next workshop, which on the screen I have the QR code if you're interested in asking some more questions. Like I said, we'll have that Q&A workshop on the 14th, and I will send that out when I send the recording out for this workshop as well. Any other questions? Aaron says, in the Q&A in a couple of weeks, is it going to include all the weirdo, obscure symptoms nobody connects to menopause? There's a million of them. Yes, so if you go back to my first workshop, I think there's like 2 or 3 slides of all the different symptoms, because there are a lot of really obscure ones that no one connects. I can send those slides out to you again, Aaron, and I can also include them in our Q&A session, just so that you can see what's out there, so that you can see what symptoms there are. So yes, I can make sure that's included. Yeah, Amanda, I will send out the recordings for 1 and 2, as well as for this one once I have it up on YouTube. So yeah, if you have any other questions, let me know. Throw them in the chat, or you can unmute yourself. You're also welcome to scan that QR code. And anything that wasn't covered, I will work to answer on the 14th. We're also working to get a OBGYN to come in and do a lunch and chat. We don't have an exact date for that, so keep your eyes peeled for that. I'll also send an email out to everyone who registered for this class so that you have that. Gwen says, I believe many GI docs are now saying that pill forms of prebiotics don't really help as they are destroyed by the stomach acids. Yes, so it is definitely better to make sure that when you're looking for your prebiotics and your probiotics that we're trying to get them from food sources, prebiotics especially, which is why she talks about, right, with probiotics, if you're not a fermented foods person, that's great to use a supplement. When you're looking at prebiotics, the best way to ensure that we're getting those is through our food. Thanks, Gwen. All right. Well, if you guys don't have any other questions, I will let you go. Thanks for joining me on our menopause journey. Like I said, I'll answer those questions for you in a couple weeks. Other than that, thanks.